As we approach 1 full year of COVID restrictions, there's new data confirming that a baby boom that some doctors and, for that matter, comedians expected is actually turning out to be a major baby bust. Health departments in 27 states provided records to CBSNews.com, and they show a 7% drop in births in December. That would be 9 months after the first lockdowns began, and it could be just the beginning. Researchers say it matches a much bigger plunge in fertility that is decades in the making. The number of babies the average woman is expected to deliver in her lifetime has dropped from nearly 4 in the 1950s to less than 2 today. And that could present an entirely different threat to society as we know it than we were first warned about decades ago.
The stakes in this battle are far greater than any other we have ever fought.
In the 1960s and 70s, an apocalyptic fear gripped America.
The experts we interviewed told us population was the fundamental crisis.
As the world stampeded toward 10 billion people, many researchers predicted that overpopulation would ruin us.
Sometime in the next 15 years, the end will come. And by the end, I mean an utter breakdown of the capacity of the planet to support humanity.
But these days, a very different note from researchers like USC professor Dow Myers, who studies demographic trends.
The trouble is that we overshot. We dropped it down too much now.
While the global population is still growing, a major study last summer predicted it'll actually peak in 2064 and then fall by nearly 1 billion people by the end of the century. The reason? Fewer babies. Here in the U.S., in fact, we're already below the so-called replacement level by some measures, and that means fewer young people to support our otherwise aging population.
That's a crisis. We need to have enough working-age people to carry the load of these seniors who deserve their retirement. They deserve all their entitlements, and they're going to live out another 30 years. Nobody in the history of the globe has had so many older people to deal with.
And the pandemic is only making this problem worse, despite some early jokes that more families staying home together might mean more babies.
We thought, oh, we would see a baby boom, but we just haven't seen it.
Dr. David Jaspin is chair of the Department of Gynecology and Obstetrics at Einstein Medical Center in Philadelphia. He says patients are worried about not only their health, but their finances.
So you're hearing more people ask you about contraception and fewer people say, we're thinking about trying.
That's absolutely true. I get a report every morning at 5:15 about what has happened in the last 24 hours. And the first report that I see is the number of deliveries in the last 24 hours. It's less than it used to be.
The question now is, how low will it go? The Brookings Institution has predicted a large, lasting baby bust of at least 300,000 fewer children in 2021.
We are on the precipice, at the very least, of not having enough children to replace our population.
And so what? I mean,
well, that's the interesting question. Yeah.
Right? So
Laura Lindberg tracks reproductive data for the Guttmacher Institute. And while she's also seeing the baby bust, she views it as a sign of progress, a marker of women's equality and freedom of choice.
So it's a shift to later in life. In that shift comes more education, more career, more employment. So it's a reordering of how people engage in adulthood.
Dow Myers doesn't disagree, but in the bigger picture, he worries our declining birth rate is also a barometer of despair.
In 1978, when you were breaking into the field, did you ever think in your lifetime you'd be talking about a declining birth rate globally?
No.
So what changed?
The burdens of life, the cost of housing, the cost of education, all these things have become more and more difficult. I think the boomers themselves don't realize how much harder it is for millennials today. And they think, oh, yeah, when we were young, we had to live, on very little money, and we made do, and you can do the same. That's the story, right? Well, no, it really is a lot harder for the young people today. It's amazing how much harder it is.
Yeah.
See how I slipped in that millennial propaganda?
Yes.
There?
But I think that's true, though.
Yeah, but it's a very important point, I think.
Yeah. So on the one hand, it is a story of a of equality and choice, but there are people out there who want to have kids but don't feel they can because their finances are a mess, or they have huge college loan debt, or they can't afford a home, or childcare is crazy.
So it sounds like it was strictly finances, but do you think part of it is you're at home and you're just really getting on each other's nerves?
Well, yeah, so yeah, everybody, there's also
I
studies
just
out
don't
there.
like you right now.
Everybody's having less sex right now, single people included, but the people who are having the least sex are people with children. Every night, actually, in my home, we have to clean the kitchen, and there's a big window, and Katie's always joking that we're putting on an advertisement for safe sex, because as we picked big spills off the floor, like the Swiffer all night long like this, you know, the crayon markings on the fireplace.
You may be putting in an advertisement for safe sex, but there is a baby coming. There's a baby.
There is a baby
couple
coming. Yeah.
You are the outlier.